All right, so I just want to start with something that I found extremely interesting about the current crisis, and that is, as of January, most people had never heard of COVID-19, and then there was some trickles of news, then there were some reports in it, and then pretty soon you had these really drastic policies adopted by states in terms of social distancing, stay at home, shelter in place. So how do you go from no knowledge about a public health crisis to rapid and widespread adoption of policies that are being designed and recommended by policy experts? So I am trying to figure out, is this situation something that is just so unique because it is really this once in 100 years global pandemic? Uh, the response was very specific to the circumstances. Or is there something about this particular case that is different because of the way that the world is changing and some of the differences in how policy is actually being conducted? So uh, the question is, what was unique about this particular circumstance? Um, I do. I'm open to interpretation on this claim, but I think that there was resistance by specific policymakers, but by and large, consensus was fairly rapid in terms of what needed to be done, and then the policies were largely adopted across a lot of different states and cities. There were even efforts to distort evidence or silence specific voices, and those seem to be less effective than they usually are in the political realm. So, the question partly is this a victory for public health experts or for public policy in general? And that's part of the interest in this. Is there something that we can take from this in terms of how the process played out to make it more effective than usual? So again, is this a generalizable case or is this just unique? I think there were some specifics that make this hard to generalize. First of all, just the political costs of not acting on a pandemic can be high because the effects are very immediate, they're very visible, and it could cause lots of problems. So there are certain motivations for policymakers to act here where it might not be the case in terms of adopting the Paris Climate Accord for long-term climate change, those sorts of public policies. Also, just the priming of the news coming from China and Italy, people were alerted to what was coming, and it might have made them more sensitive to being open to information and to policy change. The outcome is very concrete, but also the performance metrics are fairly easy to track in this instance. Number of infections, number of deaths, hospital bed, current occupancy, people on respirators. So that simplifies this particular policy domain a lot more than other policy domains. I thought partly the messaging was extremely precise, which was helpful. Most people did not know what social distancing was, would have no idea what flattening the curve means, and now that's just regular parlance and day-to-day speech. The recommendations were very clear: stay in place, wash your hands, drink bleach on occasion during news uh, briefings, so some misinformation there, but for the most part, the recommendations were pretty clear and they were actionable by individuals. So you did see kind of rapid adoption of some of those. But one other aspect that I think is interesting about this case is in terms of using information for policymaking, these epidemiological models are fairly simple. They require only a couple of data inputs and they are fairly accurate. So I'm not sure if this, again, is something that's hard to generalize to other policy domains, but I'd be curious in terms of how people perceive just the use of data in this context because of some of these models. Is it something that could be replicated in other instances? So other than the specifics of coronavirus, the main question is, has something changed in the way that the policy analysis is being conducted and by whom that contributed to the rapid adoption of a set of recommendations within the COVID case. Um, Specifically, I think there are a couple of components. One is this idea of the data economy. I mean, there are lots of different terms you can use to describe this. I loathe the terminology around big data, so trying to find something else that is a little bit more precise. But the data economy is this idea that large amounts of data are constantly being collected, but then aggregated, and the real value comes from the aggregation that allows information to be linked in ways that insights emerge. So there are actors who are intentionally aggregating those data sources and then providing them. There's a commercial side of this, but also there's an open data movement and lots of organizations that are trying to just create more resources so that people have real-time data, rich data that's linked across a variety of sources. So the question here is primarily how much of the real-time data and rapid creation as part of these analytical tools contribute to the adoption of public policy in this particular case. So the other side of the data economy is the data science ecosystem. So just the proliferation of free tools that are readily available, rapidly distributed, and then the source code is also made available so that you can adapt these tools. They're licensed for free. uh, it has created just this very rich environment where, I think it promotes innovation in terms of policy analysis at a low cost and in real time, which I think is kind of that I would pose as an argument for potentially the winning recipe in this COVID case. The combination of the pre-existing network of some of these professionals, these platforms that they were using to develop tools and share tools, and then just the real-time data that was made available during this crisis that allowed these particular applications to be rolled out. The one site that I have just been amazed by is this reference. It started out as the top 10 tools for coronavirus data science tools for our users. And then a couple days later, it was the top 25 tools. And then a couple of days later, it's top 50 tools. If you go on the site, you can see that it catalogs a collection of new packages in our various databases that have been vetted and have been specialized so that it promotes kind of open source tools. Lots of these epidemiological models have been packaged so that and documented so they're easy to use. And then a bunch of different very elegant dashboard templates have been shared so that this information can also be kind of packaged and disseminated quickly. So all of these tools, they've been created over the span of a few weeks and then shared. And as a result, if you search around, you can see just a proliferation of these different resources, especially the data dashboards where information is being presented to the public in very kind of clear and digestible formats. And in some of the instances, the dashboards enable things like scenario planning, and they are hyper local. So using data specific to a county or a metropolitan area so that people that are potentially looking at important decisions can work through these tools and just try to understand the implications of specific policies that are being adopted in their particular contexts. A lot of these examples include just some application. It might be a way of presenting data, it might be an analysis, it might be a template, but then most of them are linked to GitHub repositories or share the code directly for examples of how the information is being created. So it's really easy to just grab a few of these components and then package them together in a dashboard and then adapt that to your local communities if you're trying to get information out about specific instances. So this has me pondering, and this is not, I don't have any results from this. This is just a research design, but I'm looking for feedback from this group to see do you think that this is something unique? Was there something different about the way that policymaking occurred within the coronavirus case? And then, if so, can we link that somehow to these new tools and to the communities that were behind this? Do we think that these made advocacy for particular policy recommendations especially effective in this context? So the way that one could analyze this is starting from a framework looking at all of these dashboards as kind of a representation of the packaging and dissemination of information during this crisis. So what I was thinking is using the dashboards as a way, a sampling framework to understand information within this policymaking context. You could do a search and develop a framework that identifies all of these different sources of information, and create a population of the tools that have been created over the past couple of months with this search. Um, you can just use an iterative sampling, a search engine like Google, and then identify whether the site includes a dashboard that fits the sample framework or not, create that list that way. And then based upon that, you can also start to understand the ranking of these different websites using some third-party sites that will track web traffic to the different domains, cross-references on news and media sites, and potentially other ways to identify a kind of status of the data sources. But then once you have this list, then you could use it to unpack the idea of what's happening in terms of the mobilization of all of this information. It's a distributed community. It doesn't look like there's anyone in charge, but behind the scenes is it what we call an epistemic community, which is a group of experts that have formed kind of an expert policymaking group where they are already sharing information and sharing assumptions, have shared goals and are advocating towards long-term policy wins. So you have a lot of examples of this sort of research looking at some policy change in the European Union, and then how the networks behind the scenes, and specifically epistemic communities, tend to be, I don't want to use the term disinterested actors, but they're not the usual policymakers or interest groups that might be advocating for a policy that benefits themselves economically. They oftentimes are academics and experts that are interested in advocating for better policy. So if we take the framework of the dashboards as our framework, can we figure out who is behind them, code them systematically to learn about who's creating these tools, what their backgrounds are, what data they're drawing upon, what sorts of resources that they've leveraged from the data science ecosystem, and then how that is contributing to this dissemination of information. And then the other component of it is just the leadership behind the scenes. If there's a robust literature on successful open source communities in these kind of distributed contexts, and there's some basic findings that have come about in terms of the need for some structure, but not too much structure. But typically these communities tend to have some leadership and coordination. So you could look at especially the data sources. Who are there people and organizations that are advocating and organizing for specific data sources and ensuring that they're good data sources. Poor information could damage a movement. Are all the different actors in this space drawing upon a set of tools, a specific discipline where they share assumptions? And then how much of these are derivations of existing tools? So the things that helped limit the time and resources it would take to create these tools, which would be one reason that you see so many of them being developed. So this is a simple framework that could be used to start to analyze the process behind the curtain in terms of where information was coming from during the coronavirus process or crisis. But I'm just curious about your response to this in terms of, is this actually something generalizable? Should we be taking lessons from, do we think that the communication of policy and advocacy for particular actions was effective during coronavirus crisis? That would be the first question. Uh, Second is there something unique about how it was done in this context that can help inform us about how to be better policymakers and academics in the future? So I'll leave it there.